You know your body better than anyone, but sometimes it whispers before it screams. And when it comes to your health, ignoring small signs can lead to big problems. In this video, we're going to cover 5 crucial signs your body gives you. Symptoms that might seem minor, especially when you're young, but could be your body's way of waving a red flag. Let's get into it, because knowing what not to ignore could literally save your life. Let's start with one you've probably brushed off at some point. Unexplained fatigue. We all get tired. Between work, school, social lives, and screen time, exhaustion can feel normal. But there's a big difference between being tired after a long day and feeling wiped out all the time for no clear reason. If you're constantly low energy, even after sleep, if you wake up tired, struggle to focus, or crash midday every single day, that's not just stress. That's your body trying to tell you something. Recent research from 2024, published in the Lancet Digital Health, shows that chronic fatigue is one of the earliest signs of conditions like anemia, thyroid dysfunction, sleep apnea, autoimmune disease, and even diabetes in young adults. And here's the twist. Young people are often misdiagnosed or dismissed because they shouldn't have those conditions yet. So if you're feeling consistently exhausted and coffee just isn't cutting it, don't ignore it. Ask for a full blood panel. Rule out the big stuff first. Fatigue isn't weakness. It's often a warning. Ever get random chest pain and think, it's probably nothing? For most young adults, chest discomfort is usually dismissed as stress, gas, or muscle strain. But according to a 2023 study from Johns Hopkins, cardiovascular problems are on the rise in people under 40, especially women. The signs don't always look like Hollywood heart attacks. In real life, early signs can include tightness or pressure in the chest, sharp pain when breathing deeply, pain that radiates to your jaw, neck, or left arm, dizziness, shortness of breath, or palpitations. In 2025, the American Heart Association issued new guidelines urging clinicians to take chest symptoms in young people more seriously, especially when paired with family history, high blood pressure, smoking. Yes, it might be nothing. But if you're under 40 and experiencing chest symptoms regularly, even mild ones, don't self-diagnose. Don't just walk it off. It's always better to get checked out and be wrong than to ignore it and be too late. Let's talk about your gut. You may think bloating, constipation, or diarrhea is just something you ate. But if it's happening regularly, your body might be waving a flag. A 2023 study published in Gastroenterology showed that chronic digestive issues in young adults often go undiagnosed for years, leading to later complications, including inflammatory bowel disease, IBD, celiac disease, or early signs of colorectal cancer. Here are symptoms worth taking seriously. Ongoing bloating, gas, or discomfort after eating. Frequent constipation or diarrhea more than 3x week or lasting longer than 3 weeks. Blood in your stool. Unexplained weight loss. Feeling full quickly or loss of appetite. And while these can sound scary, here's the good news. When caught early, many digestive conditions are manageable or even reversible. Also, your gut isn't just about digestion. It's linked to your immune system, mental health, and even your skin. If your gut is unhappy, the rest of you probably is too. Your bathroom habits might feel embarrassing to talk about, but they're worth talking about. If something's not right in your gut for more than a couple of weeks, it's time to call your doctor, not just Google it. We need to talk about your skin. Yes, young people are less likely to develop skin cancer. But new data from 2025 reveals a rise in melanoma diagnoses among people under 30, especially those who use tanning beds, have fair skin, or grew up in sunny climates. But even if you're not thinking about cancer, your skin can signal internal issues like liver dysfunction, hormonal imbalance, so here are skin signs not to ignore. New or changing moles, asymmetry, irregular borders, multiple colors, growing in size, persistent rashes or hives with no known allergy, yellowing of the skin or eyes, possible liver issue, unexplained bruising, skin that itches intensely without a rash. Also, persistent adult acne, especially along the jawline or chin, can be a symptom of PCOS or hormonal. That's more than just a cosmetic concern. In 2024, dermatologists started emphasizing a new approach: skin as a window to internal health. So don't ignore it just because it's on the surface. Your skin is your body's largest organ, and it talks. You just need to know how to listen. This one might surprise you. Unexpected emotional changes, mood swings, brain fog, irritability, or anxiety that comes out of nowhere. They're often chalked up to stress, hormones, or just life. But recent research shows your mental health symptoms might actually be physical in origin. A 2025 study from Harvard Medical School linked Lancet, anxiety and irritability in young adults to blood sugar instability, thyroid issues, vitamin D deficiency, and gut dysbiosis. Here's what to look for. Mood changes that don't match your circumstances. Feeling emotionally off or disconnected. Anxiety or panic attacks with no known trigger. Forgetfulness or concentration problems that weren't there before. Young adults are especially vulnerable because mental health is often treated separately from physical health. But in many cases, they're deeply connected. Don't ignore emotional shifts just because you're young and healthy. That assumption keeps people suffering far longer than they need to. If your brain feels out of sync with your life, it might be time to check in on your body. Let's pull it all together. Your body is incredibly smart. It wants to keep you healthy, and it usually sends warnings before things get serious. The problem is, we're often taught to push through, stay tough, or wait until it gets worse. But here's the truth. Fatigue isn't just being lazy. Chest discomfort isn't just anxiety. Gut problems aren't just normal. Skin changes aren't just cosmetic. Emotional shifts aren't just in your head. These are real signals, and catching them early gives you the power to act. You don't need to panic at every symptom, but you do need to listen. If anything in this video sounds familiar, don't ignore it. Talk to a healthcare provider you trust. Ask questions. Request tests. You have the right to take your health seriously, even when you're young. Thanks for watching. Good to know. If this video helped you think differently about your health, hit that like button, subscribe, and drop a comment below. Have you ever ignored a symptom you should have listened to? We'll see you next time, and until then, stay curious, stay healthy, and stay informed.